Play mode.
Hello and welcome to the 44th Bi-Monthly Coalitions webinar. I am Kinkini Banerjee and I'm so glad you can join us for this session. This webinar series is, let me just change the screen option, great. This webinar series is referred to as the 222 and is jointly hosted by the CDC's Division of Nutrition, Physical Activity and Obesity and by USBC. It's held every 2 months on the second Tuesday of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of the series is to bring together state, territorial, tribal, and local breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. We usually alternate the sessions, so we have one webinar with a national focus followed by one that highlights state successes. So the access for this webinar is open to any coalition member or breastfeeding advocate. If you're not already on our subscription list, you can go to our website and under quick links, you'll see a tab which says sign up for news and action alerts. And once you click on that, you can join our mailing list. This national webinar hour-long session will be followed by regional calls, and for those of you who will be joining the regional calls, you will need to hang up from this call and dial in with your state's call and telephone number, and your state's designated contributors manage the call-in lines for your coalition. I'll go over some of the logistical details. The webinar handouts and other relevant resources and audio recordings of the past sessions can be found on the Coalition's webinar page. You can either find that info on the email confirmation you got, or you could go to our homepage, usbreastfeeding.org, and under quick links, you'll see the fourth item is Bi-Monthly Coalitions webinar. If you click on it, it'll take you to the page. We have a large number of registrants for today's session, so all attendees are in listen-only mode. We do encourage you to submit questions, so we'll have about 10 minutes for Q&A at the end of the presentation, and you can type your questions at any time, and here's how you do it. You should see a control panel on the right side of your screen. In case it's minimized, you should be able to see like this orange tab with an arrow. Just click on it and the control panel will pop right out. And when you scroll down, just under the audio section is a tab called Questions. Click on that blue tab which says Questions and it'll open up a dialog box for you to type your question in. During this session, if you have any technical issues or audio problems, send an email to office@usbreastfeeding.org and someone should be able to help you. And that brings me to today's topic, national activities and resources to support implementation of the federal break time for nursing mothers law. In today's webinar, we will hear about new content developed with funding from the Office of Women's Health to inform moms of their rights under the federal Breaks for Nursing Mothers Law. Our presenters will also share details on new funding awarded from the CDC to work in this area. And although the title is very long-winded, our presenters will be pithy and concise, I promise. I am very happy to introduce two members of the USBC team, Amelia Psmythe and Cheryl Lebedevitch. Amelia is the Deputy Director of USBC, and many of you may know her from her days as Executive Director of the Breastfeeding Coalition of Oregon. Amelia began her work in breastfeeding as a volunteer peer counselor, and after thousands and thousands of volunteer hours over the next decade, she gained valuable experience, competence, and visibility working on policy and systems changes which led to improved health outcomes for the public in her state. Amelia has worked extensively on state and federal lactation accommodation legislation and implementation, and we are so happy to have her wisdom and perspectives at USBC. Amelia is playing a seminal role in supporting our fearless leader, Megan Renner, and the USBC leadership team as we commit to stronger partnerships with our community-based stakeholders. especially those providing mother-to-mother peer support, peer and professional support. Cheryl is our Media, PR, and Development Coordinator, and Cheryl and USBC is a match made in heaven. Cheryl was a dedicated advocate for for mothers' rights before she joined USBC as an intern. As a young mother and a full-time student at the University of Illinois at Chicago, she helped catalyze a movement to construct the university's first mothers' rooms, providing private spaces for staff and students to express milk. At USBC, Cheryl wears many hats, writing our newsletters, building and maintaining our social media presence, helping design some many e-campaigns. Cheryl has been dedicated to this OWH initiative for more than a year. She brings a warmth and enthusiasm for her work that is infectious, and many of you will probably find her at USBC meetings and conferences, huddling with our member reps, setting up their Facebook accounts, and teaching them the mysteries, magic, and reach of Twitter. So now when you get the weekly Wednesday Wire and other news and announcements from the USBC office account, I hope you will have a face to go with it. And with that, without further ado, I'm going to turn it over to our wonderful panelist. Cheryl will go first. Go ahead, Cheryl.
Hi, Kinkini. Thanks so much for that great introduction. We're very excited to share the results of our work with you and are glad you can join us for this webinar today. As you know, the federal break time for nursing mothers provision requires employers to provide reasonable break time and a private non-bathroom space for hourly paid workers to express breast milk during the workday. Next slide, please. So to support implementation of the law, the USBC was funded by the Office on Women's Health to enhance the coordination and reach of effective messaging for mothers about the law. The official federal resources on the law are the statutory language, the Associated Department of Labor FAQs, and the DOL fact sheet number 73.
I'm sorry to interrupt, Cheryl. Kenny, you just need to open the PowerPoint version. You have the PDF up.
I see. Yep. I see. Sorry about that, guys.
Okay.
I'm going to...
So to make this information more accessible to moms, we combined all these resources into a single user-friendly online guide. So this content is supplemented with additional information from the business case for breastfeeding, as well as other official federal resources on related topics. And this was to make sure that the guide was as comprehensive as was possible within the scope of our project. And while the guide does address many of the most common questions USBC receives from moms and employers, moms are still going to need your guidance and support to really deal with situations that are not addressed in here. So later on in this webinar, we're going to share some preliminary results of a gap analysis showing where questions we typically receive are not adequately addressed in the government resources and therefore are also not adequately addressed in this guide. So we'll be asking for your help to ensure that the gap analysis is as complete as possible for our presentation to the Department of Labor. We're also excited to share some news about additional work USBC will be doing under an agreement with the CDC to supplement and promote this resource. Next slide, please.
Sorry about that, Cheryl. Is this the right one?
I think I could just go ahead talking while you...
I think you go one back, Kenny. The one with the picture of the website.
Okay.
Fabulous. So the aim of this project was to ensure that all moms have access to the information they need to exercise their rights under the law. So to make the information as widely accessible as possible, it was all written at a 6th to 8th grade reading level, which turned out to be one of the more challenging parts of the assignment. To make extra sure this content was clear and understandable, though, we also completed a target audience review. So at this point, the base content that we created had already been through a preliminary approval process with the Office on Women's Health. It was very, very long, so we divided it into 10 sections for the review and recruited volunteers through our social media networks. We asked anyone who was interested in participating to complete a form that had background information and contact information. and had a total of 167 respondents, which was very exciting. We took these respondents and we narrowed them down to 100 volunteers by taking into consideration the many factors listed on this slide here, especially race and ethnicity and education level. And we wanted to do this to make sure that we were in fact reaching our target audience and also to make sure that we had plenty of diversity among our reviewers. Out of the 100 volunteers that were selected, 47 of them did complete reviews of one or more of those 10 sections. And they really gave us awesome feedback. We had tons of suggestions, tons of edits, and they really helped to make it a stronger document. This was all integrated. And then, next slide, please. Once all this information from our target audience reviewers was integrated, it went through another clearance through the Office on Women's Health, and the final approved content was used to create our new online guide. So what you need to know about the Break Time for Nursing Mothers Law was just published on the USBC website last week. It includes 20 sections covering everything from the basics of the law to preparing to go back to work to how the federal law intersects with state laws, and all kinds of questions are answered. Next slide, please. So now I'm just going to point out a few highlights from this guide. There are lots of questions that and information included in the guide that we're not going to mention today. But we just wanted to talk about some of the things that are really most commonly misunderstood about the law, which the number one thing, of course, is the undue hardship exemption. So the online guide really aims to clarify that all employers are required to comply with the law. Employers with fewer than 50 employees can apply for an undue hardship exemption in response to a complaint, at which point they would then have to prove significant difficulty or expense in relation to the size, resources, or structure of the organization. So even if an employer has fewer than 50 employees, they still must comply unless the federal government has issued them an exemption in that particular case. Next slide, please. Then one of the other common points of confusion is about who is actually covered by the law. So the Break Time for Nursing Mothers Law only applies to non-exempt or hourly employees covered by the Fair Labor Standards Act. The online guide includes a flow chart and a full explanation to help moms determine whether or not they are covered. This is a really helpful resource, and this is one that we expect to see a lot of traffic. And we'd also like to just quickly note here that the Supporting Working Moms Act would expand the break time law to an additional 12 million workers, including teachers and administrative professionals. And you can find more information on this on our website. Next slide, please. Another common point of confusion is involved with how state and federal laws interact with each other. So what the guide works to clarify is that when both the federal and the state government address the same situation, the stronger law applies. This means that if your state has a workplace breastfeeding law that is stronger than the federal law, your state will overrule the federal law only in the places that it is stronger. So there is a full explanation of this so that you can figure out what exactly this means in your state, and it includes a great example from Colorado. Now, these are some of the top questions we receive, and the guide addresses many, many others, but there still remain unanswered questions that we need further guidance on. So this is what we're going to refer to in our gap analysis for the Department of Labor. Next slide, please. So we're really excited to have published this resource, and we'd really like to make sure that it gets into the hands of the moms who really need it so that they can exercise their rights under the law. So please share away. The link is included on here. Please share through social media or through your newsletters. It would be great. Feel free to reach out to us for sample posts or retweet us or share our links. We would think that was really great. Next slide, please. So as we stated earlier, there are 3 official sources of information on the law. There's the statutory language, the Department of Labor FAQ, and the Department of Labor fact sheet number 73. So the USBC completed a gap analysis looking at the questions that are frequently asked of us and how they intersect with these 3 resources. Many of these questions are covered in the request for information on break time for nursing mothers, but not in these official sources. So this request for information, the RFI, is not an official source of reference, meaning that the DOL is not implementing the law based on this document. But it does provide the Department's initial interpretations of the law. And according to the Department of Labor FAQ on the RFI itself, it states that until the Department issues final guidance, the RFI provides useful information for employers to consider in establishing policies for their nursing employees. So we're going to look at the gap analysis. Gap analysis will look at what information from the RFI would be useful or needed as part of any final guidance, and also looking at any additions to the FAQ or fact sheet, set number 73, as well as offering additional suggestions to support the implementation of the law. Next slide, please. So to complete this analysis, the USBC staff broke down these three resources, these three official resources, as well as the RFI, according to the topic to compare how each of them addressed the situation. And we noted any significant gaps in the official sources. 3 volunteers from our Nursing Breaks Law Task Force then compared our chart to a list of inquiries we received to identify recommendations to the Department of Labor on additional guidance needed by employees and employers. As we go through this list today, we'd like you to think about the mothers and employers you help. We want to collect feedback and additional insight if there's anything we missed. So at the end of the presentation, we're going to share a link to a survey where you can share your feedback. So please, throughout this presentation, feel free to take notes of any suggestions or additions to our current recommendations, and your feedback will then be integrated into our recommendations, reviewed by the task force, and then following approval via the USBC Rapid Response Procedure, will be submitted to the Department of Labor. And with that, I'm going to hand over to Amelia Psmythe, who will present our recommendations. Thank you.
Very good. Thank you so much, Cheryl. So looking at the next slide, continue. Thank you. So as Cheryl mentioned, we're hoping that our very careful process has enabled us to have a comprehensive set of recommendations for the Department of Labor. But of course, we're relying on you as our state coalitions and folks in the field to let us know if we got it right. So looking at the first topic, we see that there's widespread confusion about which employees are covered. So our recommendation number 1 is that the Department of Labor add language that highlights existing resources to help mothers determine coverage. And in particular, we'd like to see the Wage and Hour Division phone number and the Fair Labor Standards Act Advisor online tool listed up more prominently within their materials. Next slide. So because of the flexibility that's been built into the law, and the ways that the workday can be extended, we see that employees have expressed concern that exercising their rights under the law will impact other workplace benefits. So our second recommendation is that the department add language that encourages flexibility, particularly in cases where health insurance benefits relate to the hours that are worked. Next slide. When we consider the frequency and duration of these breaks, we find that the amount of time needed for milk expression is impacted by many factors. So our third recommendation is that the department look to the language that they've actually already included in the RFI that provides a very nice summary of these considerations, and that they pull that into their other official resources to support that employers assess the reasonableness of break time provided to a nursing employee with a mind to all the steps that are necessary to reasonably express breast milk. Next slide. So as we continue to consider frequency and duration of milk expression breaks, we feel it's important that employers are educated about the variance of production and consumption of breast milk, which impacts milk expression. So the USBC, therefore, is going to recommend that the Department of Labor clarify that the frequency and duration will vary from mother to mother and from session to session. Next slide. We find that many employers do not know where to turn for support when seeking to comply with the break time law, and therefore our fifth recommendation is going to be that they highlight employer resources, including the online guide and the state breastfeeding coalitions. Of course, we lift up the state breastfeeding coalitions, but we would like to see the Department of Labor do that directly. Next slide. So recommendation number 6 is looking at some privacy concerns that we see. We know that there's confusion about what is considered sufficient to meet the law's requirements that a space be shielded from view and free from intrusion. So our 6th recommendation is that when any space is provided for expressing milk, the employer must ensure that the employee's privacy is provided for through means such as privacy curtains, a lock on the door, or signs that designate when a space is in use, as long as the sign is accompanied by a well-communicated policy on how the employees should behave in respect to that sign. Next slide. We find that in many locations, the most suitable space for breastfeeding employees is in a manager's office, but increasingly, those spaces often contain security cameras, which compromise the employee's privacy. So we are going to recommend that the department address these concerns, and in particular, that they clarify an affirmative statement that the presence of a camera in a location does not qualify a business for undue hardship. And we will further recommend specific creative solutions for those circumstances. Next slide. So although the law does not require dedicated permanent space, employers still need to be prepared to accommodate. So we recommend that they encourage employers to always have a plan for how to accommodate a breastfeeding employee. So for example, if they have an employee visiting from another branch or another work site, they need to be prepared to accommodate that situation. Mostly we want to encourage them to be thinking this through, even if it's not applicable to them at this moment in time. So next slide, please. And we think about adjoining bathrooms. We know that there's a lot of questions, and in particular that there's confusion about if or when spaces that are adjoining toilet areas are acceptable. So we come up with all these funny ways to talk about it. So a toilet area is the way that we're getting at this one. So when we look at recommendation number 9, we request that they add language clarifying that an anteroom or lounge area connected to a bathroom is sufficient only if it's fully separated from the toilet area by a permanent and closed wall. In addition, we need to know that that area is smoke-free, as well as meeting the thresholds for being shielded from view and free from intrusion. So the next slide relates to locker rooms. So a locker room, we get a lot of questions about this, and a locker room will meet the requirements of the law only if there is no toilet or shower as part of the locker room, or if the pumping space within the locker room is separated from the toilet and shower, again, by a full closed wall. If the toilet and shower area within the locker room is not separated by a closed wall, then the room must be treated as a room for the adjoining bathroom. So to further explain that, if the locker room is functioning as a changing room, like maybe there's an employee that's moving in and out of a uniform every day, it could be adequate to have the pumping station within that space as long as there's not a toilet or shower area sharing the space, and there is a shield from view, and the milk expression break is happening free from intrusion. So we recommend that they add language that where there's not sufficient differentiation between the toilet area and the space reserved for expressing breast milk, the space would not meet the requirements of the law because it prevents similar health and sanitation concerns as a bathroom. So a lot to say about that one because we get so many questions about it. You know, as we've been encouraging employers to think very creatively about what the solutions are, you know, then of course you get questions about would this work or would that work or can we fit it here? And so I think as you're talking to employers and to moms, you can be holding in mind these very basic things. You know, it has to be sanitary. It has to, you know, meet a minimal threshold of preserving health, and it has to, you know, provide privacy. That's informing these recommendations. So looking at the next slide, we know that there's a number of questions that come up regarding the number of breastfeeding employees within a given location. So some workplaces, particularly where there's very large employers that employ a large number of breastfeeding employees at any single time, we see that employers need guidance on how to calculate and plan for adequate pumping stations. So we recommend that they clarify that because the statute requires employers to provide break time each time such employee has the need to express milk, employers should consider the number of nursing mothers employed and their work schedules and the size of the campus to determine the location and the number of spaces to designate or create. Again, if more than one employee uses the room at one time, that could be acceptable if there was a privacy screen or curtain that was necessary, that was provided in order to meet the threshold of being shielded from view. Next slide. So some employees wish to breastfeed directly during the workday, either by visiting an on-site or nearby child care center, or having a caregiver bring the child to the workplace, or by leaving the worksite to visit the child in a nearby location. The USBC recommends clarifying the definition of milk expression and encouraging employers to allow mothers direct access to their babies where the worksite can safely accommodate this. So this is in alignment with the Surgeon General's call to action number 15, which states, expand the use of programs in the workplace that allow lactating mothers to have direct access to their babies. It's important here to note that even high-efficiency double electric pumps are unable to empty the breast as efficiently and effectively as a baby feeding at the breast, and directly feeding cuts out the need for time to set up and clean the pump. So the key to success for these programs is setting them up just like any other workplace policy, with clear rules and expectations to guide behavior and prevent potential problems. So we're often asked where this distinction came from, and I wanted to share that the federal Break Time for Nursing Mothers law that protects milk expression and not direct breastfeeding is based on an Oregon state law, which was developed through extensive input from multiple stakeholders. And advocates there learned that too many work sites are not considered safe for children. So a compromise was struck to protect milk expression, and it would simply not have been feasible to pass the law as a mandate if every employer had to allow direct breastfeeding in every work site. But USBC believes that this language encouraging direct breastfeeding where it's safe to accommodate would be a good addition to this topic. Next slide. So when we consider space functionality, employers continually request additional guidance on space requirements under the Break Time for Nursing Mothers law. So the USBC recommends pulling information from the RFI to further define the term functional from the FAQ, which is at a minimum a space that must contain a place for a nursing mother to sit and a flat surface other than the floor on which to place the pump. We would like to see the Department of Labor provide more information on the provision of sinks and refrigerators, highlighting how these amenities can reduce the amount of break time that's needed. Additionally, USBC recommends that the department add language clarifying that the space should require proper ventilation, lighting, climate control, cleanliness, and freedom from mold, bacteria, and chemical contaminants in any lactation space. The next slide relates to questions with storage. We know that employers need some guidance regarding milk storage, and so we recommend that the department add language stating that while employers are not required to provide refrigeration options for nursing mothers for the purpose of storing express milk, they must allow a nursing mother to bring a pump, an insulated food container to work for expressing and storing the milk, and ensure there is a place where she can store the pump and insulated food container while she is at work. Additionally, we'd like to recommend highlighting the OSHA statement that expressed breast milk is not a biohazard and can be stored in community refrigerators. Next slide, please, continue. So as we recognize that travel is required by many employees. And so we would like to propose that the department add language that clarifies an employer's obligation to provide time and space regardless of where the employee is located, including the obligation to arrange with a client when an employee is going off-site for space to express milk at the client's site. So in other words, the employer's obligation doesn't stop when the employee leaves their work site. It follows that employee wherever she's traveling for her job. Next slide, please continue. So we're also hearing from employers that they need materials from Department of Labor that have embedded the information about the law so that it's really clear and consistent in all of their materials and ready to go for the employers to hand to the employees. So we would like to recommend that the department include information in all of their publications and trainings. And this would include a model Know Your Rights sheet for employers to give to workers. It would include information about the statute in the employer and employee trainings on FMLA and minimum wage and overtime laws. We think it would be a good idea if they required employers to provide notice of this provision to pregnant women who are covered under Statute 4207. We'd also like to see that in all of the department's model notification and posters that it's made clear that workers may have more rights under certain state laws. And finally, we would like to see that the department include in all postings and notifications that it's available in multiple languages. And this is the case already for posters and notifications required around other statutes, and we would just like to make sure it's consistent for this law as well. Next slide, please continue. So this is a very dense slide because this is a very high-level topic. We know, I'm sure you all recognize, there is widespread misunderstanding that businesses with fewer than 50 employees are not required to comply. And we also know that there's confusion about counting of employees for undue hardship exemptions. So because businesses with fewer than 50 employers are eligible to claim undue hardship under the nursing mother's break time requirements in response to a complaint, we would like to recommend that the department add clarifying language in 4 different components. First, that employers under 50 may not presume undue hardship. We would like that number 2 for them to, or B, for them to clarify how and when the number of employees is calculated. C, we would like for them to include that a previous exemption will no longer apply if the number of employees rises to above 50. And D, that once accommodations are made, they cannot be taken away if the number of employees drops. So this is, again, from very careful review of the available materials and look at the common questions that we're receiving. We're hoping that by lifting up this set of recommendations to the department, we can address a lot of these common concerns and have the department really clarify and simplify exactly how employees can be accommodated and receive their rights under the law. So next slide, please continue. So again, we find that there's widespread confusion about the application of the undue hardship exemption. So we would like to recommend that they add language clarifying that the undue hardship will operate as an affirmative defense raised by an employer seeking to demonstrate why they're unable to accommodate a particular employee. But clearly, it cannot be sought in advance. It must be demonstrated in response to each individual complaint. Again, we find that this is coming up very frequently in questions that we receive, and that's probably true for many of you in the field. And we're hoping that, if this language seems right and resonates with all of you and gets through our full process, we can be making a strong recommendation to the Department of Labor about how to clarify and simplify the understanding in the field. Next slide, please continue. So we know that there is confusion about whether breaks can be considered to be part of the family medical leave or counted against an employee's FMLA leave entitlement. So while employees are entitled to take FMLA leave to bond with their newborn child, the department, in our understanding, does not consider expressing milk at work to constitute bonding with or caring for a newborn child. And also, while an eligible employee may take FMLA leave due to her own serious health condition, we believe the department does not intend that expressing milk will typically be associated with a serious health condition under the FMLA. So that we therefore would like to recommend that the department adds clarifying language about this. So next slide, please continue. So as mentioned, we are very keen to collect your feedback. And so the survey link will be activated shortly after the webinar ends. And we look most forward to hearing from you. You can raise up questions that you have or give us comments or feedback, in particular if there's anything that you feel we missed. Next slide, please continue. So I now get the great pleasure of sharing some exciting news. As announced in last month's Wednesday Weekly Wire, we've received new funding from CDC. This is a cooperative agreement called the National and Innovative Partnership for Addressing Obesity through Environmental Supports for Nutrition and Physical Activity. And what's very exciting to us is that this really places an emphasis on innovative partnerships. And I think that we've all experienced that when we forge new ties with additional organizations and partners, we have the opportunity to really spread the work that we're doing through collaborative engagements with new people. So it's exciting to see the CDC putting an emphasis on that kind of work, of reaching out and being the connector with other entities. So that's something that USBC does. I think that's the nature of coalition building that we all experience, and it's awesome to have that called out and supported through this funding. Next slide, please continue. So through this funding, we are really taking on two different program strategies. The first is a project to provide access to professional and peer support for breastfeeding. And the second strategy that I'll tell you a little bit more about is related to worksite laws. So we want to promote and facilitate worksite compliance with federal and appropriate state lactation accommodation laws. Next slide, please continue. So we have two primary activities underneath the workplace strategy. The first, I think you'll be very excited to hear about this. We're going to conduct an inventory and analysis of state laws and how they intersect and overlap with the federal law. We know how much that's needed, and we look forward to having that analysis done and being able to share information. As Cheryl discussed earlier in this webinar, the new guide that we've put online includes information about how to go about figuring out the rights within a given state where there is a state worksite law, but we would really like to be able to have that information available and posted somewhere as a much easier reference rather than giving everyone a worksheet to calculate. So we're really excited about that component of the project. Second, we will be forging new partnerships for the promotion of this information, which will include partnerships in online media and a webinar training to promote the new federal law resources we've told you about today. So next slide, or last slide, continue. So that concludes our big news, and we're very pleased to have you all join us. I'm sure that there's some announcements, but probably there's some questions as well before we move into announcements.
Thank you, Amelia and Cheryl. And we do have a few questions. There's one question which says, would allowing direct breastfeeding require legislative change, or can this be done just through a DOL clarification?
Well, I think that it could start through, I don't really know the definitive answer to that, but certainly starting with the Department of Labor, I think there's more flexibility within that mechanism. And so that would be, one way to get it going. I don't know that we're going to see guidance from the Department of Labor, although we can continue to ask for that and encourage it. But my sense is that the fact sheet and the frequently asked questions is a place where they could be explaining that and what the intentions are and what their purpose is. Applying our experience in Oregon, I would think that, again, if I don't know that a child can safely be in enough workplaces to be able to unilaterally require direct breastfeeding in all places. And so it could be that the best mechanism to get at this is an employer encouragement within the FAQ or the fact sheet of DOL. That's my gut about it.
Okay. Thank you. There's one question about some challenges encountered for women in retail locations, and it says the company has a lactation policy, but it is tailored for central office workers, not workers in the retail location. So in effect, the policy is practically useless. Can you talk about this? And I think you mentioned that.
Yeah, I guess I wasn't quite sure. I mean, I caught what you said, Kinkini, about that the question relates to retail locations. But what's the specific question? Is it looking for some examples of how accommodation can happen in that setting, or what's the question?
I think they said that the lactation accommodation laws, I can hear my own echo for some reason. Is someone else have it?
It's hard.
Yeah.
I can't hear it. If you can talk through it, we can hear you okay.
Okay, thanks. For some employers, the lactation accommodation laws are implemented in their central offices, but not at other locations, at retail locations. And I think that was the question asked, that this, and the recommendations made would be that they apply everywhere, right?
Right. Yes. So I do understand that question. We do see that sometimes within a corporate office that has, that sometimes that space is more obvious, or sometimes those employees are treated differently than those in the field, whether it's the fast food restaurant or the retail location, or the front line shops. And that the corporate office has a different set of behavior. Absolutely, the way we understand that employees must be counted is across all locations. So let's see, I hope I'm not jumping around too much, but if we think about the example of a bank where maybe there are a smaller number of tellers that are distributed across several different locations, we have to count employees across all those locations. And ultimately, for the fair implementation of this law, it would not be appropriate for some employees to be treated differently than others, even while we can understand how an employer might find it easier to accommodate in a corporate office setting than in a retail shop setting, that they still have to find a way to do it. Does that answer the question?
I think so. Yeah, thank you. Yeah, that it applies to other locations. Another question about will there be language about job protection so that there's no retaliatory action taken if low-wage workers and undocumented workers exercise their rights?
Yes, and I believe, I could be wrong, but I believe that that language has been added to the poster that DOL has made. But I think that that's an excellent example of something else that could be lifted up in our recommendations to ensure that we're highlighting it. So I hope that whomever submitted that question, that you please fill out the online survey, and we'll also be making note of that very important observation, so that we can make sure that we craft a recommendation around that and put it through our process of our task force and rapid response committee. So thank you.
Thank you. And one question was that, can you give us some example of how to work around the security camera issue at the workplace?
Sure. Cheryl, do you want to take that, or do you want me to?
Sure. So some of the solutions that have been found in the field have included things that are as simple as shutting the camera off temporarily, putting something over the camera, using some kind of poncho over the mom. It really just depends on the comfort of the mom and the situation and the layout of the office. So we are really hoping that we'll be able to provide more information and more solutions through these resources and the additional recommendations to make those simple solutions really obvious, because sometimes it's just a lot simpler than it seems.
I think, again, the main thing is flexibility and respect. And so, I think the most important thing is that the employer be looking for a solution that's really going to work for both sides, and that if the room that has the camera isn't going to work, either because the employer can't shut it off or cover it, or the employee isn't comfortable being in there even if somehow shielded from view, then they have to find a different location in order to make it work. And that the presence of a camera in and of itself does not qualify them for undue hardship. So our recommendation is going to ask them to clarify that, because, again, we've seen an increase in the number of security cameras in those types of locations.
Okay, we have one last question that we have time for, and that is about the CDC innovative our cooperative agreement, and the question is that will some of the project be done with state coalitions at the local level?
I think that there will be resources that are provided in terms of training webinars that we produce, any kind of social media outreach opportunities that we'd certainly be looking to partner with the state coalitions. At this time, this round of funding does not include funding for state coalitions to engage in these activities, unfortunately. At this point, through this mechanism, the extent of opportunity for the state coalitions, again, is going to be in information, partnership, and suggestions around activities that you could engage in. And I know that's a disappointing thing to hear. I wish that there was more to say about this. That's certainly something that USBC cares about, and that our funders all care about also. I think everybody is looking to see a way to bolster the state coalitions from a funding place and improve sustainability. It's always forefront in our minds.
Thank you, Amelia and Cheryl, for that. And we are going to move on to somebody here has their phone on speaker. So if you can mute that, then I won't hear my echo. So we're through with the questions, and we are on to hear some CDC announcements, and I'm going to turn it over to Larry Grummerstrom, Chief of the CDC's Division of Nutrition, Physical Activity, and Obesity. All right, Larry, you're on.
Thanks, Kinkini. This is not Larry.
Carol McGowan.
Yeah, that's fine. This is Carol McGowan. Thank you, USBC, Amelia, and Cheryl in particular. This was a really tremendous and informative webinar, and I really appreciate that you're giving an opportunity for more comments to come in before you finalize it. Thank you. I have two very short announcements to give today, mostly based on a number of questions that we've been getting over the last few weeks. So the first one is about the MPINC, or the Maternity Practices in Infant Nutrition and Care Survey. Just to let everybody know, so you all know, that we began contacting hospitals to participate in the 2013 MPINC survey in mid-October of 2013. Since we include all maternity hospitals and birth centers in the U.S. into the survey, which includes more than 3,000 facilities, it takes us several months to make all the initial screening calls to the facilities. All the facilities should be contacted by the end of December. Some of the facility surveys have been sent out already, and some have been completed, but they will continue to go out as additional hospitals are contacted. So I can't tell you what states or what facilities or how many are still left, but it will continue still for a couple more months before we close this down. The second announcement I have has to do with the funding that went out to the state health departments. We're calling it, in short, the State Public Health Actions Funding. It was given to all states in July 2013. 32 of the states received additional funding to support multiple chronic disease and health promotion strategies, which include breastfeeding. Under the heading of increased access to breastfeeding-friendly environments, the states could choose to address one, two, or all three of the following strategies. One being to implement practices supportive of breastfeeding in birthing facilities, which can include helping these facilities work towards baby-friendly designation. The second, to ensure workplace compliance with federal lactation accommodation law. And the third, to provide access to professional and peer support for breastfeeding. And just to let you know, we've reviewed the work plans that have come in, and the strategies selected were 21 states are working on the breastfeeding practices or baby-friendly initiative in birthing facilities. 17 states of the 32 are working on workplace compliance with federal lactation accommodation law, and 8 states are working on peer and professional support. So this is an opportunity to become part of the partnership, to work with the state health department. You have, as coalitions, you have a lot of practical and subject matter expertise in these areas, and I expect and hope that the state health departments will be reaching out to you for support in this area. And that's all I have, Kinkini.
Thank you, Carol. Those are exciting opportunities for our state coalitions, and thank you for sharing those. So I am going to move on to our own announcements here. And our 2014 Coalitions Conference is from August 2nd to 4th, and the Conference Program Committee is starting up their work to plan and facilitate this conference program that meets USBC strategic priorities and the training needs of our state coalition leaders. And we are very excited to be able to host you in a new venue this time, the Crystal Gateway Marriott. You'll also notice that we've renamed the event the National Breastfeeding Coalitions Conference. And although we've historically focused on state coalitions, we will continue to provide subsidized travel and set aside registration spots for 2 attendees per state coalition. The content of the conference is relevant to all types of breastfeeding coalitions, and that means it includes state, territorial, of course, but also local community level coalitions, which we are increasingly seeing and wanting to support. Action at the community level is a focus both of our Best Fed Beginnings partnership as well as WK Kellogg Foundation grant work. So we also want to encourage cultural coalitions such as tribal, African American coalitions. We are also increasingly seeing these coalitions form and want to support them as well. As you know, that equity is a major focus and priority going forward for us. And so also includes the national organizations who are members of USBC as our national coalition. So most of our member organization reps now also attend the coalition conference. So this name change just made sense for all of us, and we will be a major commitment of USBC and an emerging priority for all breastfeeding organizations is to focus on ensuring equity in breastfeeding support. Our theme is transforming barriers into bridges, cultivate your community leadership. And on our conference page on our website, you will see much more detail and description of the objectives. And stay tuned for calls for proposals. So some of the major objectives are to develop, leaders with knowledge and skills in coalition building and provide a forum for sharing, and more especially develop a capacity and commitment to achieve racial equity in our breastfeeding support so that coalitions can play a role in ensuring that all families have access to quality breastfeeding support and success. So in winter, we'll be sending out the calls for proposal, and they could be for many formats. So we really encourage you to apply and to present the work that your coalition is doing. We will be taking proposals for breakout sessions, including panels for breakfast table topics, for poster presentations. And as with previous conferences, each state territory is asked to select 2 individuals who will receive travel and lodging support, as also a reduced registration rate as a coalition-sponsored attendee. So you will see the guidelines for attendance, and so we ask you to kind of go through those guidelines and on our website as you begin your selection process. Currently, there is no separate funding for tribal coalitions. And as of December this month, we do not have anything confirmed yet about the state, territory, ITO, WIC breastfeeding coordinator funding support yet. But regardless of whether travel or lodging support becomes available, we will be offering reduced registration rates for WIC breastfeeding coordinators. We also have slots for open attendees, so coalitions can send any number of people to the conference. And so, however, there is a maximum capacity and a first-come, first-serve for the open attendee slots, so register early for those. And following the conference on August 4th, we will have our day of action, or our advocacy day. And the advocacy day activity is critical for coalitions to build relations with congressional staffers. So coalition members are strongly encouraged to participate on visits to the Hill and educate our elected officials on their staff on issues that impact breastfeeding around the nation. So we will be providing you training, box lunches, transportation, and materials. So please be sure for those reps coming to the conference that you also participate in our Advocacy Day action. So with that, it brings us to the end of this wonderful session. Thank you again, Amelia and Cheryl, for giving us all the information on this important law. We will ask that you submit your comments on the survey link. And for those on the regional calls, you will can hang up now and join your regional sections. We would love you to fill out your evaluations and send us suggestions for future topics, because we do listen to what you have to say and set up our speakers accordingly. So thanks again, happy holidays, and we'll see you in 2014. Thank you.